Hi, I'm Delegate Bob Brink, and this is my second weekly report on the issues that we'll be facing in the Virginia General Assembly. I'm at the Virginia Hospital Center in Arlington, and today I'd like to talk for a little bit about health care. One of the most important things that government can do, both at the federal and state level, is to make sure that people have adequate access to quality health care. As a member of the Virginia House of Delegates, I've made this a major focus of my work in Richmond. I've been a member of the Joint Commission on Health Care since 1998, and there I've worked to promote policies that ensure that children and people who live in medically underserved areas in Virginia have access to health care. And as a member of the Health Subcommittee of the House Appropriations Committee, I've worked to ensure that the health care safety net services are adequately funded. Over the next few months, Virginia will have the chance to make major strides in working toward the goal of adequate health care for all of its citizens. First, beginning this Tuesday, October 1, Virginians will have the chance to sign up for health insurance under the Affordable Care Act, Obamacare. If you go to the new health insurance marketplace at healthcare.gov, you can shop for a health plan among companies who will be competing for your business on the basis of price and services offered. Since coverage cannot be denied on the basis of existing medical conditions, many people will find that they're able to afford individual health insurance when they couldn't before. And through a program of tax subsidies, the federal government will assist low-income Virginians in being able to afford medical insurance coverage. And we need to consider the consequences if Virginia refused to expand Medicaid. First of all, Virginia taxpayers are going to be sending their federal tax dollars to other states that have accepted Medicaid expansion and getting nothing in return. And in addition, the people who need medical care are still going to need that care, but instead of having a stable medical home where their conditions will be treated early, they'll be turning to emergency rooms, such as the one here at Virginia Hospital Center. Emergency room care is the least efficient and most expensive way of providing medical attention to an individual. Without Medicaid expansion, the hospitals are going to be facing a huge financial burden all across Virginia. The November election presents us with clear choices, particularly in health care. Terry McAuliffe, the Democratic candidate for governor, is in favor of expanding Medicaid in Virginia and in providing adequate health care to all of Virginia's citizens. On the other hand, his Republican opponent, Ken Cuccinelli, has fought the Affordable Care Act at every step without offering any kind of realistic alternative. I look forward to working with Terry McAuliffe on health care issues in the future, and so I hope that you'll vote for him and for me on Tuesday, November 5. Again, this is Delegate Bob Brink, candidate for re-election from Virginia's 48th Delegate District, and thank you for listening.